7 early signs of infertility in women you shouldn't ignore. Are you trying to conceive or planning on starting a family someday? Your body might be telling you something very important, but are you listening? These 7 early signs of infertility in women could be the silent signals standing in the way between you and your future family. Don't wait until it is too late. Your reproductive health might just depend on what you learn in here in the next few minutes. First thing first, what is infertility? Infertility is the inability to conceive, though I prefer to call this difficulty because eventually you will conceive. So, infertility is the inability to conceive despite having unprotected regular intercourse for at least 12 months, that is, if you're under the age of 35, or for at least 6 months if you're 35 years and above. Infertility can happen because of a health issue with either you or your partner, and in some cases, because of a combination factor with both you and your partner to prevent pregnancy. But not to worry, I've been there. There are so many safe and effective treatment options that could boost your chances of getting pregnant, ranging from lifestyle changes to ovulation induction to fertility treatments, fertility supplements, surgical procedures, and even to more advanced techniques such as in vitro fertilization and intrauterine insemination so as to boost your chances of getting pregnant again. The only best treatment option would depend on the underlying cause of the infertility in the first place. So, back to the topic at hand. Top 7 early signs of infertility in women that will keep you away from infertility. I prefer to call these the warning signs. So, the first for today is irregular or absent menstrual period. Your cycle is said to be irregular when it deviates from the usual or the normal pattern. This deviation could be in the length of the cycle, it could also be in the length of the period flow. But overall, any cycle length that becomes longer than 35 days or shorter than 21 days is no longer normal. And your period flow is not supposed to be more than 7 days long. So let me know in the comment section if you do not know how to calculate the actual length of your cycle, and I will do that for you. There are a number of causes that can make you or that can cause your period to become irregular. The first of them are physiological changes, which includes pregnancy. You might be expecting your period and it's no longer coming, it's already over 35 days and you've not seen your period. Before you start thinking something is wrong with you, I think you should consider doing a PT test. It could be a double line. And then if it is not pregnancy that is the cause, just know that is a warning sign. You are beginning to experience irregular period, and the next thing to do is assess yourself. Another thing that could cause you to have irregular menstrual period is hormonal imbalance. Any slight change or fluctuation in your hormone, especially hormones such as prolactin, estrogen, or your progesterone, could cause you to miss your period. And trust me, this is not normal. It's a warning sign, and it's telling you you need to do something before this continues to progress. Another cause of irregular menstrual period is obesity. You have gained weight so much and it could have distorted one or two things in your system. So in this kind of case, it's good to shed some weight and be back on track again. Another thing that can cause you irregular period is excessive exercise. It's good to exercise, it's good to be fit, but in everything you do, moderation is the key. Don't jump into having very long hours of exercise when previously you weren't even someone that used to do few minutes of exercise. So in everything you do, moderation is the key. Gradually step into your exercise routine before you can become a pro in that area. Another thing that can cause you irregular menstrual period is eating disorders, certain kind of medications, and underlying ailments amongst other causes. I don't want us to dwell so much on these causes of irregular period. Just maybe there will be a particular time where I'll have to talk about so many causes of irregular period so that you become very acquainted with them. So let's jump right into number 2. So the second warning sign of infertility in women that could keep you away from infertility if you act is too heavy or painful menstrual period. When your period begins to get so heavy or you begin to experience very severe menstrual cramps, which of course wasn't there before, it could be a sign of an underlying health conditions such as endometriosis. Endometriosis is a condition whereby the tissues that are found inside of the uterus begins to grow outside of the uterus. This is completely not normal, and most time one of the early signs is severe menstrual cramps or too heavy period flow. So when you begin to see some of these things all of a sudden, the best thing for you to do is to act fast. So number 3 warning sign for today is unexplained weight loss or weight gain. All of a sudden you begin to add so much weight, or you're beginning to lose so much weight even without incorporating any dieting or any exercise regime. This could be a sign of a hormonal imbalance, and it should raise your eyebrows. It is not normal for you to begin to just lose weight all of a sudden. If you've undergone some tests such as maybe RVD amongst other tests and they come back normal, it is time for you to begin to think in the line of hormonal imbalance, because it could be a cause. Number 4 warning sign for today is painful intercourse. It is not normal for you to experience pain during sex. I mean, when you're not a virgin, if it is not vaginal dryness that is causing this painful intercourse, then it could be a sign of an underlying ailment, maybe same endometriosis or probably fibroid this time around. And it is time for you to now begin to see your healthcare provider. I have a detailed video in this my channel where I have talked about vaginal dryness, the causes, and the treatment options. A lot of things you can do to take care of vaginal dryness so you don't begin to experience unnecessary pains during sexual intercourse, which is not supposed to be there. So number 5 warning sign for today is excessive hair growth. Excessive hair growth in certain areas such as the face, the chest, the back, and in certain areas that ordinarily hairs are not supposed to be there, especially in females, could indicate that your body is beginning to produce more of male hormones such as the androgen and testosterone in more than the amount which is supposed to be found in female. I wish I can use a filter to demonstrate some of these places whereby a female will now begin to experience hairs. But some of the places that your chin, you're supposed to be having hairs there, your chest, especially if they weren't there before, begin to experience some of these hairs. It could be a sign of polycystic ovarian syndrome, which is PCOS, and this is a very common cause of infertility in women. Number 6 warning sign of infertility in women for today is sudden acne breakouts. All of a sudden you get a whole lot of breakouts, especially around the chin and jaw lines as well. They could be a sign of hormonal fluctuations. Sometimes it could be normal. Some people tend to experience acne breakouts towards the time of their period, or just maybe when they are pregnant. But if either of these factors don't apply to you and you're experiencing breakouts that don't go away even after applying some self-care remedies, then it could be hormonal imbalance, and it is the best time for you to see your dermatologist to rule out any significant infertility connection with the acne. So the 7th infertility warning sign for today is severe pelvic pain. That is, you begin to get severe abdominal pain, especially around the time of your menstrual period. This could be a sign of infertility problems such as same endometriosis. So you should be very careful enough to spot some of these changes, some of these warning signs, so that you seek medical help on time. And like they say, early detection always save a lot in every case. Another one I want to add is repeated, or let's call it recurrent miscarriage. If you've had more than one miscarriage, all right, it could be a sign of infertility. If it is a miscarriage that happens during the first trimester, any first trimester miscarriage usually caused as a result of hormonal imbalance. If it's a miscarriage that happens during the second trimester, it could be caused as a result of structural or anatomical defect with your cervix. And most times a cervical sacrilege could be just your solution there. So recurrent miscarriage is a warning sign. Yes, I advise you don't get pregnant again until you have ruled out, or at least until you must have treated what caused you to miscarry more than once. So in conclusion, my dear brethren, if you're still here up to this point, I mean, I mean, you're getting value. Please give this video a thumbs up, hit on that subscribe button and turn on the notification bell so that each time we upload a new video, oh my God, you will join us. So in conclusion, oftentimes, the only sign of infertility you may get is the inability to conceive, having tried for some time with regular unprotected sexual intercourse for a period of 12 months or 6 months, depending on your age. But sometimes our bodies can be kind enough to present us with some of all these warning signs. So please be sure to listen to your body so that you can spot these changes on time and begin to seek professional help, which is with your fertility specialist. All right, at this juncture, I will tell you to please subscribe to this channel so that we continue growing and you follow us along in everything we do. Thank you so much for watching, and I'll see you in my next video. Bye.